Hi, Margaret Brackman with the Nebraska Office of Rural Health. I am going to tell you about the first award that we've got, and that's the Emerging Leader Award. The Emerging Leader Award is presented to a new or existing individual State Office of Rural Health staff member who has demonstrated new leadership, initiative, involvement, or commitment in the mission of NOSORH or State Offices of Rural Health. This individual will have shown exemplary communication, passion, or understanding of an issue to enhance education, advocacy, or partnerships to improve rural health.
Hi, I'm Ashley Wallace, and I'd like to share a few reasons why I view my supervisor, Caroline Rosinski, as an emerging leader. When she started in September 2019, Caroline sat down in her new role as a Flex and Ship Coordinator, as well as the overall Kansas Office of Primary Care and Rural Health Coordinator, to hear me vent about my issues and things that I saw at work that I wanted to change. She listened as I told her my pie-in-the-sky hopes I want to see our office accomplishing in the coming years. She also made sure to have us fill out a questionnaire of our favorite snacks, sports teams, and office supplies. Two of my fellow co-workers left around the same time in early 2020. Then I left for maternity leave the same week that COVID-19 was declared a global pandemic. Caroline was left alone to do her own job, which is technically two person's jobs, plus 3 more jobs, so that's like 5 jobs. Despite all of this, she dove headfirst into learning about all our different grants and programs, not including the new 2020 COVID grants, and just the atrocity that was 2020 in general. As our coordinator, Caroline is tasked with keeping it all together. We were not well organized before she stepped in with her color-coded calendars and matching pins. Thanks to her many years of experience of working with stakeholders, as well as event planning skills and ability to think outside the box, our office has leveled up. As a leader, she genuinely cares not just about the work we are doing to improve the quality of life for Kansas residents, but also her colleagues who are showing up every day to get it done. We have a moment of Zen channel in our teams group where we post resources for taking care of our mental health, cat pictures, and much more. With her tenacity and work ethic, Caroline does it all. Thank you so much.
Hi, I want to say thank you so much. I am honored to be receiving the NOSORH Emerging Leader Award. When you love your work, it shows. And I love my work because I am so fortunate to work with some great people. We are small but mighty and have the saying, everything is figure-outable. Thank you to Ashley Wallace, Amber Kelly, Josh Koger, and new to the team, but key nonetheless, Catherine Amick. My team has been amazing while I continually put us in classes and conferences to learn all there is to know, and they don't shy from new opportunities to support rural health in Kansas. They continue to make it possible for us to move from what felt like a passive office to a dynamic office that has continually reached out to new organizations and communities in our state. We are proud of the steps we have taken to involve stakeholders in activities, providing cultural humility trainings for healthcare workers, various webinars, including virtual yoga for healthcare workers, and building more ways of acknowledging rural healthcare workers. Thank you to Katie Mahurin, who has been a constant sounding board, level head, and support for me. I also have to give credit and thanks to my boss, Amy Swanson, who allows me the leverage to get things done and grow our program. They say those whom we support hold us up in life, and my team is a strong example of that. I'm privileged also to have state partners such as the Community Care Network of Kansas, the Kansas Recruitment and Retention Center, Wichita State University, Community Engagement Institute, and HealthWorks, along with others, continually assist us in our mission. And of course, thank you to all the rural providers in the state of Kansas for all they do, especially in the past few years. In the words of Bob Moed, you can work miracles by having faith in others. To inspire the best in people, choose to think and believe the best about them. Thanks again to NOSORH for this honor and all the work they do.
Next award is the James D. Bernstein Mentoring Award. The James D. Bernstein Mentoring Award honors an experienced rural health individual leader in a state office of rural health who has a sincere interest in emerging leaders' professional growth and has played a key role in developing future leaders within the national rural health movement.
2006, Montana became home to one of Minnesota's finest, Miss Kristen Juilliard. Chris's dedication to enhancing the access to quality health care in the Treasure State and her expertise and commitment to leading teams has led to many advancements in healthcare for Montana. She's led the charge as the director of the Montana Office of Rural Health and Area Health Education Center and just recently turned the page to a new chapter in her book, Retirement. Looking back on Chris's career, she has a mountain of accomplishments. And at the peak, you'll find the investment that she put into supporting and developing the future leaders and healthcare professionals that are also leading the charge in rural America. Mentoring is work of the mind, but it's mostly work of the heart. On behalf of the Moore AHEC family and beyond, Chris, thank you for your dedication to every individual that you've shared your wisdom and passion with. We're so excited that you're the recipient of this award. We know that once a mentor, always a mentor, and this is a chapter that will never close.
I am so honored to accept the Jim Bernstein Award. I would like to thank the wonderful people who work at the Montana Office of Rural Health for nominating me. They are the absolute best, and I am so lucky to have worked with them. Thanks especially to Kaylin for the nomination, and a shout out to Natalie, NOSORH President-elect. I have benefited so much from the mentorship of people like Dr. Frank Newman and my old boss back in Minnesota, Terry Stone. They taught me that even the smallest communities can come together to accomplish great things. I've truly loved being able to spend time in the frontier communities in Montana and getting to know so many wonderful people. I grew up on a farm outside of a town of about 300 in southern Minnesota. My parents helped raise money for the first ambulance in the town of Frost, and my brother was a volunteer EMT there for over 40 years. Rural health has been in my blood since I was a child, and I have got to grow up and work in a field that I love so much. Thanks to everyone at NOSORH for being such great friends and mentors. The Region E group has been there for me since I moved to Montana, and I am so thankful for everybody on the NOSORH staff. Thanks again for this great honor. Thank you.
Andrew W. Nichols Rural Health Advocate Award recognizes an individual or organization who has made significant contributions to rural, frontier, or border health, demonstrating deep commitment to health equity and improving the health of underserved populations.
Hi, everyone. It's Lisa Davis from the Pennsylvania Office of Rural Health, and I'm really happy to be here to be able to introduce you to the person who will be receiving the Andrew W. Nichols Rural Health Advocate Award. Rural health advocacy and focus at the federal level has never been more important than during the global pandemic and the national public health emergency. Dr. Diane Hall from the Centers for Disease Control and Prevention, or the CDC as we affectionately know it, has been a tireless advocate for rural health at the agency. As the senior scientist for policy and strategy, Diane has focused her efforts on advancing rural health at the federal level and communicating regularly with state offices of rural health and other rural health advocates. She has been a vocal supporter of rural health with the CDC and served as an informal liaison between the states, the state offices of rural health, and the federal agency. As part of the CDC's COVID-19 response, Diane serves as the lead of the Rural Health Subteam in the Disproportionately Affected Adult Populations Team and the Vaccination Task Force. She led the development of the CDC's national initiative to address COVID-19 health disparities among populations at high risk and underserved, including racial and ethnic minority populations and rural communities. This funding supports all states in addressing pandemic-related rural health disparities. All SOARs have or will receive funding from these grants, which will substantially support the state offices, expand critically needed activities, and broaden state offices' reach, impact, and visibility. During the pandemic, Diane participated in a number of virtual meetings with state offices and truly was a great Fed. She listened to our concerns, provided thoughtful and meaningful input, and recognized both the successes and the challenges at the CDC in addressing rural COVID-19. She made herself available to every state office and welcomed the opportunity to learn about and advocate for rural health with the agency. The Andrew Nichols Rural Health Advocate Award recognizes an individual who has made significant contributions to rural health, demonstrating a deep commitment to rural health advocacy and improving the health of underserved populations. As someone who had the great pleasure and honor of working with and knowing Andy Nichols, I can say that Diane epitomizes these qualities, and through her focus on rural health and the needs of rural residents, she has helped to ensure that resources are directed to serving rural America. So Diane, congratulations and well deserved.
Thank you, NOSORH, for this incredible award. Thank you also to Lisa Davis for taking the time to submit the nomination, and thank you to the awards committee. As a civil servant, so much of what I do is behind the scenes, which makes this recognition even more special. I've had the privilege and honor of serving as CDC's Rural Health Lead for over 4 years, and it's the work that I'm most passionate about. Thank you so much for letting me know that I am making a difference in some way.
Our last award for today is the NOSORH Award of Excellence. The NOSORH Award of Excellence is presented to a state office of rural health that has made outstanding contributions in the field of rural health, including broad benefits to rural health, innovative programs, and activities that have enhanced state offices of rural health.
My pleasure on behalf of the Illinois Critical Access Hospital Network to have nominated Julie Casper for the National Office of State Offices Rural Health Award, Exceptional Award this year. Julie is the rock and compass of rural health care in Illinois, and it's just such a delight to work with. She is the program director or officer for the state office for the Illinois Department of Public Health, which handles all the rural programs for Illinois, which is quite a job. She has been in this capacity for more than 15 years and gives out countless hours of time and support to all of us out here in rural Illinois. Julie is limited in her staff, but that doesn't limit her in her ability to support us either through grant letters of support or helping us out with all sorts of projects and so forth. She knows and understands rural, and she is willing to participate on our different projects such as rural OB shortage area, working with the Illinois Rural Health Association, Illinois Primary Care. She really understands what's going on and accepts the challenges and takes them forward to the Department of Public Health and other state and federal agency. She represents Illinois on NOSORH, and she's attended many of the National Health Association conferences, and she's always there to lead the way. Julie is really platinum in her work with Grant. She really expects us to be the very best, and she goes above and beyond to make sure all the details are just right. She's a wonderful example of public service, never wants to do anything for recognition, but always for the support and the betterment of our rural communities. She's a proud grandmother, and she's a pillar of the Springfield community, and very much loves dogs and helping people, and it's just really such an honor to be able to nominate her. She's just a great individual, great sense of humor, and truly represents what we believe is best in state offices and people to work with.
Thank you so much to ICANN for nominating the Illinois SOAR and NOSORH for selecting Illinois for the Award of Excellence this year. Some of my fellow SOARs know that Illinois is a one-person SOAR, but I'm surrounded by support from the agency, our local, state, and federal partners, and have been for 25 years. Rural residents are resilient even in the face of a pandemic, and so are all of you. These last couple years have been difficult and challenging with COVID, and yet our partnerships have grown stronger than ever. I work with amazing people in my office on programs outside of this SOAR, and my supervisors have made it clear that rural is a priority not just in our agency, but in this administration. Our director, Dr. Ngazi Ezike, leads the agency with science and compassionate. She's truly extraordinary, so it's no surprise that the people who surround her in senior management are as well. We have many statewide partners, but I have to give a shout out to ICANN, the Illinois Critical Access Hospital Network, for not just because they nominated us for this award, but because they've been a trusted partner for 20 years. Pat Scow and her team are revered not just in Illinois, but across the nation, and we couldn't do what we do if it weren't for them. Fellow SOARs, thank you for being partners and friends. You're people I know that I can count on, and you can do the same. Nationally, NOSORH, you are the preeminent partner and source for all things SOAR. You're always informed about the latest policies, a resource for information, and you're great fun to be around. The trifecta in my book. All of these groups are the Illinois SOARs Village. The only way we can accomplish a goal of greater access to healthcare services in rural areas are through leaders of excellence. That's all of you on this call today. Thank you again to ICANN for nominating the Illinois SOAR for the Award of Excellence, and NOSORH for selecting us for this prestigious honor.